Hey everybody, Stephen Fogg with Fogg Media. I hope you're all faring as best you can during this national and global pandemic and emergency. We have COVID-19 and coronavirus, and you're all heeding the cautions that we are too of social distancing and just really being mindful of your surroundings. But I want to just take a few minutes of your time to just talk about the different stages of healthcare or medical marketing during a crisis that we've learned firsthand, maybe some predictors for what's moving forward. So maybe how you can get yourself, your brand's positioning ready for what's next. Let's first talk by taking a step back of like what's happened. When it comes to the healthcare marketing side of things, what has happened first? Well, first, probably about, depending on where you're at in the country, between a month to 2 weeks ago, was COVID-19. And how is your practice, your hospital system, your healthcare facility, whatnot, prepared for COVID-19? And what is your stance on it? So many of you sent out press releases, maybe email blasts, messages on social media, whatever it might be, talking about, here's COVID-19, here are your cases, here are your symptoms. If you have anything, don't come here. But this is our official response on what COVID-19 is. And so that went on for about a week to 2 weeks of putting that out. And our brand, along with many other brands, were helping get that message out to patients and providers and business partners and vendors and whatnot along those lines. So you had that part of marketing. Your messaging was shifting away from acquisition marketing in most senses to crisis communications. He went to the crisis communication side of things, and so the first phase of crisis of marketing along those lines was, what is your position with COVID-19? The second phase was, what are you doing in response to this? And I'll tell you, overwhelmingly, we saw that the response was to get telehealth in place. Now, I'll tell you, I'm gonna speak on this for a second, and I'm speaking out of term. Forgive me, but this is great. I mean, many of you guys stepped up to get the infrastructure in place to get e-visits online. I know the DHHS and the government and Medicaid and Medicare relaxed a lot of laws on their end to allow this to be done more cost effectively, easier to implement, and all those things. So I saw even the smallest of practices implementing some sort of Skype or Zoom sessioning for their patients. Anywhere to do telehealth where you can still communicate those. Get that interaction going with their patients. So many of you guys implemented telehealth, and then that phase of the marketing sense was get that message out. Newsletters, email blasts, social media, you name it. What is it? How are we gonna tell them that we are still open for business and we are willing and love to still virtually see you? So the first step was kind of reporting what is our stance on the emergency, COVID-19. Second was, what are we doing to stop it? Now, we are starting to see the next phase of almost pandemic marketing, I guess we can call it that, with some of the larger global brands. That is really changing your messaging in response to the problem. So what are you seeing already with some large global brands? Well, they're changing their messaging to reflect what's going on in the world. So, you turn on the TV this morning and you see Cadillac talking about zero interest financing for 3 years on a new Cadillac. Bojangles is talking about they changed all their voiceover work to promote drive-through. Picking up a sausage biscuit this morning at drive-through. You're even looking in newspaper and Scott's Miracle-Gro is telling you need to get outside and go plant a garden because you're quarantined. This is something you can really do. Get out, get some fresh air, and hang out with your family. Those are just a few examples. Pharmaceuticals, I saw a big ad they're doing to pushing out how they're ready for it. But it's basically, what are you doing how are you changing your messaging to relay in the new world order, I guess we have, when it comes to what's going on. Those are a few examples. Some other things that you could be doing. This is like, what additional offerings are you doing? Are you presenting for to be of value, of service? So you're seeing drive-through. Restaurants are doing drive-through takeouts, maybe some orders. We see have some of our clients doing something similar with like, buying supplements or gift cards. Everybody's doing e-visits. What can you be doing to value add your proposition? Is it your knowledge base? It's along those lines to think about what it could be. But so, that's where I see the system at now. Like again, we spent the first bit of COVID talking about COVID-19 response. The second phase of this was getting what are you doing in response to it? Telehealth, most of you were doing. The third phase is how you're repositioning and repivoting your brand in the new norm. And that's kind of how I see it, where we see the trajectory of healthcare marketing right now. I'll tell you, we are doing all we can to kind of help our clients with this. We definitely saw, we're a big digital firm, big SEO, AdWords, pay-per-click, all those things, which are still vastly important. And I'm going to get to those on another video, hopefully this week. But what we saw what you guys needed most was writers. So we've kind of called in some of our writers to help with the demand. So that's our value added proposition we're doing, and we're also going to be doing a lot of videos like this as well. But what are you doing? I'm curious to know what type of value added proposition are you delivering to your? I'm healthcare specific, so what are you doing in your healthcare specific clients? But if you're not in healthcare and you're still watching this video, what are you doing to add value to your client's proposition during this really tough time for all of us? That's all I have for this one. I appreciate you watching the whole way through. If you have any questions, comments, concerns, please feel free to comment in the video wherever you're seeing this, and somebody will get out to you and we'll talk. If not, I hope you're staying safe out there. I hope you're staying sane. I know quarantine can be very difficult for many people, including ourselves, and we're just we're here to help. So, hope you have a great day. Thank you, and take care. Bye bye.